Bismillahirrahmanirrahim. So we will start with the quote from Quran. La in shakartum la iziyadannakum. So if you are grateful, I will give you more. This is from Quran. Today I will be presenting the topic of gonorrhea. My name is Dr. Taimia Ayub, and I will be presenting this topic under the kind supervision of Professor Dr. Saira Afzal, Dean, Institute of Public Health, Lahore. So this is the learning outcome outline of today's lecture. We will start with the introduction, then we will cover epidemiological triad, followed by chain of transmission, diagnosis, management, and treatment. Then we will apply levels of prevention. Then we will do burden of disease, recent advances, and at the end we will cover multiple choice questions. This is the learning outcome of today's lecture. So we will start with the introduction. Gonorrhea, it is a bacterial infection caused by Neisseria gonorrhoeae that causes urogenital, anorectal, conjunctival, and pharyngeal infections. Urogenital tract infections are most common. It is second most frequently reported bacterial sexually transmitted infection after chlamydia trachomatis. Co-infection with chlamydia trachomatis is very common. Gonorrhea is also sometimes called the clap or the drip. It is very common, especially among young people ages 15 to 24 years of age. The gonorrhea is classified into three types. First of all, it is the gonorrhea of the urogenital organ. The second type is the extragenital gonorrhea, or known as gonorrhea of mouth, rectum, pharynx, tonsils, and eyes. Third is the metastatic or disseminated gonorrhea. It is a complication of first two types. This is the epidemiological triad. We will cover all the three points of environment, agent, and host. First of all, we come to the agent. Agent is it is caused by gram-negative diplococcal gonococcus neisseria, Neisseria gonorrhoeae. It is shaped like coffee beans, um, concave surface facing each other. Gonococcus main pathogenic organism adapted to destroy mucous membrane covered with columnar epithelium. In patient's body, gonococci often undergo L transformation after using chemotherapeutic drugs. So the host for host is the natural host is human, sexually active adolescent and young adults 15 to 29 years of age. Higher risk is present in with multiple sexual partners, inconsistent condom use, previous STI history. Environment. Organism is fragile and cannot survive outside of human host, affected by temperature changes, drying, UV light, and other environmental stresses. Organism cannot be transmitted from clothing, toilet seats, or household utensils to healthy persons. Organisms can affect any sexual active person even if they are healthy, and they are also affected by antimicrobial misuse. That is one of the most important issues. So there are many risk factors for gonococcal infections. It is present in adult or younger than 25 years of age, as I have just mentioned. It is also common in black race, a history of gonococcal infections or other STI, inconsistent condom use, men who have sex with men, new or multiple sexual partners, prostitution, substance use, and in cases of children, mothers with a history of STIs or substance abuse, mothers without prenatal care or not receiving ophthalmic prophylaxis at birth, and history of sexual abuse. So this is the pathogenesis flowchart. First of all, there is infection, then attachment to host cells and corkscrew movement and travel to lymph nodes. In perivascular lymphatics cause endarteris obliterans. Then there is loss of blood supply and finally genital ulcers. So the incubation period is 1 to 14 days. Onset of symptoms in starts in 2 to 8 days. So when we come to signs and symptoms, in men, there are discharges, pain or swelling between the thighs in groinal region, burning or painful urination. In women, there can be discharge of like vaginal discharge, burning or painful urination, pain in the lower abdominal region, and or abnormal bleeding from vagina or anus. So then there we have conditions in neonates, like neonatal conjunctivitis. It can occur in neonates from exposure to infected cervical secretions during delivery. Neonatal conjunctivitis treatment is important to prevent the perforation and blindness. And then in adults, we can have newborn arthritis, pharyngitis, rhinitis, rarely pneumonia, vaginitis, urethritis, localized scalp infections or abscesses, sepsis, or meningitis. Prenatal screening and treatment of pregnant women for gonorrhea is the best method for preventing Neisseria gonorrhea infection among neonates. Then we come to disseminated infection. Disseminated gonococcal infection is rare, affecting 0.4 to 3% of patients with gonorrhea. For example, skin infection, tenosynovitis, and septic arthritis. Rare diseases progression may result in perihepatitis, meningitis, or endocarditis. There are complications like pelvic inflammatory disease, epididymitis, which can lead to infertility, and then disseminated gonococcal infection, which is usually characterized by arthritis, sinusitis, and/or dermatitis, as explained. So the treatment is recommended for with antibiotics. Treatment is recommended for a person who has a positive gonorrhea test, anyone who has had sexual contact in the past 60 days with a person diagnosed with gonorrhea, whether or not they have symptoms or have used condoms. This is the updated CDC treatment guideline for gonococcal infections, and in this there are treatment for uncomplicated gonococcal infections. Then there are alternative regimens for uncomplicated infections. Then we have similarly, for uncomplicated gonococcal infections of the pharynx, I will try to explain them one by one. For treatment, first of all, we have first line treatment for uncomplicated gonorrhea. Current standard regimen for adults and adolescents are ceftriaxone 500 milligram IM single dose, and it can be increased to 1 gram IM single dose if body weight is more than 150 kilogram. Treat a concomitant chlamydia unless excluded. As explained previously, chlamydia infections are very common with gonorrhea infections, so they should be treated simultaneously. Add doxycycline 100 milligram orally twice daily for 7 days if chlamydial infection has not been ruled out. This recommendation aligns with guidance from World Health Organization and Centers for Disease Control and Prevention. Then we come to alternative regimens when ceftriaxone is not feasible. Then cefixime 800 milligram orally single dose or doxycycline if chlamydia not excluded. Use only when injectable ceftriaxone is unavailable. Dual therapy with azithromycin is no longer routinely recommended due to resistance concern. Then we have management of special clinical situations in which we have, first of all, pharyngeal gonorrhea. In this case, ceftriaxone 500 milligram IM single dose and test of cure is mandatory 7 to 14 days after treatment. Then comes rectal gonorrhea, same regimen as uncomplicated infection. Test of cure usually not required if ceftriaxone used and symptoms resolve. Then we come to disseminated gonococcal infection. Ceftriaxone 1 gram IV or IM every 24 hours. Continue for 24 to 48 hours after clinical improvement. Then switch to oral therapy. Total duration is at least 7 days. In cases of gonorrhea in pregnancy, ceftriaxone 500 milligram IM single dose is given. Avoid doxycycline. Use azithromycin if chlamydia treatment required. In cases of neonatal gonococcal conjunctivitis, ceftriaxone 25 to 50 milligram per kilogram IV IM single dose, and medical emergency because there is a risk of blindness in neonates. Now we come to cases in which there are HIV co-infection is present alongside gonorrhea. Persons who have gonorrhea and HIV infections should receive the same treatment regimen as those who are HIV negative. So, there is one important issue of antibiotic resistance in Neisseria gonorrhoeae. What is AR gonorrhea? Antibiotic resistance is the ability of the bacteria to resist the effects of drug used to treat them. This means that the bacteria are no longer killed by a drug that used to kill them before. The bacteria that causes gonorrhea has grown resistance to nearly every drug ever used to treat it, and it is only a matter of time until it becomes resistant to the last available cure. CDC estimate that 1.6 million new gonorrhea infections occur each year, and that half of those infections are resistant to at least one antibiotic. So, following the spread of gonococcal fluoroquinolone resistance, the cephalosporin antibiotics have been the foundation of recommended treatment for gonorrhea. The emergence of cephalosporin resistant gonorrhea would significantly complicate the ability of providers to treat gonorrhea successfully. Since we have few antibiotic options left that are simple, well studied, well tolerated, and highly effective, it is critical to continuously monitor antibiotic resistance in Neisseria gonorrhoeae and encourage research and development of new treatment regimen. Now we comes to level of prevention. We will try to apply all three levels of prevention on gonorrhea also: primary prevention, secondary prevention, and tertiary prevention. So, in primary prevention, we have health education, promotion of safe sexual practices, condom use, sexually transmitted infections awareness program, screening in high risk groups. No currently licensed gonococcal vaccine exists. However, interest in gonococcal vaccine development has been reinvigorated not only by the marked increase in gonococcal AMR but also by mounting scientific data suggesting gonococcal vaccine are biologically feasible. For secondary prevention, we have early diagnosis through screening, prompt treatment of cases, partner notification and treatment, surveillance and reporting. In tertiary prevention, management of complications should be done like pelvic inflammatory disease or infertility, hospitalization for disseminated gonococcal infection, counseling and rehabilitation, fertility services if required. So now we come to burden of disease. So, for a global overview, prevalence among women was highest in WHO African region, 1.9%, then followed by region of America, 0.9%, and Western Pacific region, and were the lowest in European region. Similarly, among men, prevalence was highest in African region, 1.6%, followed by Americas, Western Pacific, and lowest in the Europe. Incidence was highest in WHO African region, Americas, and Western Pacific. So, according to WHO estimates for 2020, there were approximately 82 million new cases of gonorrhea annually among adults aged 15 to 49 years of worldwide. More broadly, curable STIs, including gonorrhea, chlamydia, syphilis, and trichomoniasis, account for over 1 million new infections per day in age 15 to 49 years old globally. Prevalence. Global prevalence estimates suggest gonorrhea affect about 0.8% of women and 0.6% of men worldwide at any point in time. So, untreated gonorrhea, as explained previously, it can cause pelvic inflammatory disease, infertility, ectopic pregnancy, and increased HIV transmission risk. There is much regional variation. Burden varies by region with higher prevalence and incidence in low and middle income countries and sentinel populations like sexual workers and MSM. In Middle East and North Africa, systematic review pooled estimates found a mean prevalence of about 1.9% in general populations with higher rate in certain subgroups. So this is the figure representing percentages of Neisseria gonorrhoeae isolates with resistance to cefixime and or ceftriaxone per WHO GASP data 2014 for most countries, 2011 to 2013 for some. This was the latest available information according to WHO which I was able to find. So you can see um, so the resistance, if the color is red, the resistance was very much, which is fortunately not the case. So in cases of Blue is the type of least resistance. Then we have yellow, in which there was resistance of 0.1 to 5%. Then we have orange with 6 to 30%. So Pakistan is currently in the yellow region, and India and China are in 6 to 30% in the orange region. So it is increasing with day by day, as we know that antimicrobial resistance is a very important and pressing issue. And as we can see that antimicrobial resistance is very much true for any disease we are covering. So the same is the case with gonorrhea, and special consideration should be given to AMR in every at every step. So, for national burden in Pakistan, Pakistan does not have a routine national STI surveillance system that systematically reports gonorrhea incidence and prevalence figures. National estimates are largely based on facility based studies and small sample data rather than population representative surveys. In a cross sectional study of STI patients attending a hospital in Pakistan, 13% of the patients were diagnosed with gonorrhea among those presenting with symptoms or attending for STI evaluation. This is very high percentage, but as mentioned above, that such studies are being done on facility based or clinic based studies. So, and the hospital and the sample size is based on hospital, so the percentage of the disease will definitely be more than the population level studies. And then a population survey among urban men reported a gonorrhea prevalence of 0.8%, although the rates varied substantially between cities. Underreporting in service gaps challenge accurate burden estimation. So 0.8% is nearly in the same range as the global general population level prevalence, as explained previously. So for recent updates, more countries report rising level of drug-resistant gonorrhea, warns WHO. This is a report published on the World Health Organization website on 19th November 2025. It says that WHO warns that gonorrhea, sexually transmitted infection, is becoming increasingly resistant to antibiotic, according to new data from its enhanced gonococcal antimicrobial surveillance program, EGASP, which monitors the spread of drug-resistant gonorrhea. The report highlights the need to strengthen surveillance, improve diagnostic capacity, and ensure equitable access to new treatment for sexually transmitted infections. The release of the new data coincides with World Antimicrobial Resistance AMR Awareness Week, reinforcing the importance of global action against drug-resistant infection. EGASP, launched by WHO in 2015, collects laboratory and clinical data from sentinel sites across the world to track AMR and inform treatment guidelines. Okay, so in 2024, 12 EGASP countries in 5 WHO regions provided data, an increase from just 4 countries in 2022. So it increased from 4 to 12 countries. This is a positive development reflecting a growing commitment to track and contain drug resistant infection in countries and region. These countries, Brazil, Cambodia, India, Indonesia, Malawi, Philippines, Qatar, South Africa, Sweden, Thailand, Uganda, and Vietnam, reported 3,615 cases of gonorrhea. Over half of all cases of symptomatic gonorrhea in men, about 52%, were reported from countries in WHO Western Pacific region, and countries of WHO African region accounted for 28% of the cases, followed by countries in Southeast Asia region, and then Middle East, Eastern Mediterranean region, and at the end there were from the regions of Americas. The median patient age was 27 years. Among cases, 20% were men who have sex with men, and 42% reported multiple sexual partner within the past 30 days. 8% reported recent antibiotic use, and 19% had traveled recently. So these are some of the populations in which it was concentrated. Rise in antibiotic resistant gonorrhea may be due to wide use of doxycycline for other STIs. So this is um, the latest from Harvard T.H. Chan School of Public Health. It was published in 15th July on 15th July 2025. Basically, the article focuses on the presence of resistance in treatment of gonorrhea, and they noted that US and several other countries have recommended high risk individuals, including men who have sex with men and transgender women who have had bacterial STI in the prior year, take doxycycline after having unprotected sex to avoid getting infection with an STI. But the new study found that this practice, called doxypep, the post-exposure prophylaxis, appears to be playing a role in increase in antibiotic resistance, particularly in gonorrhea infection. And similarly, multi-drug resistant gonorrhea, an emerging global threat. It was published on peer-reviewed. It was article which focused on that despite the challenges, there is hope for development of new treatment and vaccines. Promising candidates such as zoliflodacin and solithromycin have shown efficacy in clinical trials, while vaccine development faces obstacles due to bacterium's antigenic variation. And then it focuses on the paper underscores the urgent need for continued research, surveillance, and development of effective strategies to combat drug resistance gonorrhea. And investment in new treatment and vaccine is crucial to mitigate the spread of infection and its associated complications. So now we come to multiple choice questions. So the MCQ number one, a 24-year-old male presents with dysuria and a yellowish urethral discharge for the past 3 days. He denies any systemic symptoms but reports unprotected sexual intercourse with a new partner. Um, 2 weeks ago, Gramston of urethral discharge reveals intracellular gram-negative diplococci. What is the most likely cause of a causative organism? E. coli, Neisseria gonorrhoeae, sorry, Chlamydia trachomatis, Treponema pallidum, or Trichomonas vaginalis.
B.
B.
Beta.
Yes. So it is present with at the age of the male along with dysuria and the urethral discharge. So now we come to MCQ number two. A 21-year-old male presents with a painful swollen right knee. He denies any trauma but reports urethral discharge 1 week ago. Joint aspiration shows purulent fluid and cultural reveals Neisseria gonorrhoeae. What is the most likely diagnosis? Septic arthritis, reactive arthritis, rheumatoid arthritis, gout, or osteoarthritis?
A.
A.
Yes, so the answer is septic arthritis. It is due to the of infection followed by gonorrhea infection. So now we come to MCQ number three. A 28-year-old male presents with conjunctivitis, urethritis, and arthritis. He has history of unprotective intercourse 4 weeks ago. Nucleic acid amplification test confirms gonorrhea. Which of the following syndromes does this patient most likely have? Reiter syndrome, Fitz-Hugh-Curtis syndrome, disseminated gonococcal infection, Stephen-Johnson syndrome, or Bessett's disease.
C.
C.
Yes, so this is DGI, also known as disseminated gonococcal infection. So now we come to MCQ 4. A 30-year-old woman presents with lower abdominal pain, fever, and mucopurulent cervical discharge. Her sexual history is significant for multiple partners. Which of the following complication is she most at risk for if left untreated? Infertility, pyelonephritis, rectal fistula, renal failure, or endocarditis.
A.
Yes, infertility is one of the most important complication. A 28-year-old woman presents with severe pelvic pain, fever, and irregular vaginal bleeding. On examination, she has cervical motion tenderness and adnexal tenderness. Her history is significant for untreated gonorrhea. What is the most likely complication she is presenting? Pelvic inflammatory disease, endometriosis, ectopic pregnancy, ovarian torsion, or appendicitis?
A.
A.
Yes, yes. Pelvic inflammatory disease is one of the most important complication. Uh, people with gonorrhea are commonly co-infected with chlamydia trachomatis. Which of the following is the treatment regimen for such a patient as recommended by CDC? Single IM dose of ceftriaxone, oral 500 milligrams ceftriaxone for 7 days, single IM in ceftriaxone shot along with oral doxycycline for 7 days, or single dose of both ceftriaxone and azithromycin, or IV dose of gentamicin.
C.
Yes, doxycycline should be given along with ceftriaxone for treatment of these two infections. Gonorrhea is treated with antibiotic. What problem has occurred recently in treatment? Antibiotics have been in short supply. The bacteria that causes gonorrhea have become resistant to certain antibiotics. People have developed an allergic reaction to certain antibiotics. Intolerance and adverse reaction associated with antibiotics, or that antibiotics have become expensive.
B.
B.
Yes, yes. Antibiotic resistance is one of the most important issues currently being faced. A 5 days old neonate develops fever, irritability, and poor feeding. Both cultures reveal Neisseria gonorrhoeae. What is the most likely complication in this infant? Neonatal sepsis, neonatal meningitis, neonatal pneumonia, neonatal jaundice, or neonatal encephalopathy.
A.
B.
It is they have just given blood culture for clue, which reveals the Neisseria gonorrhoeae. So we will go with neonatal sepsis. So it is option A. A 2 days infant develops swelling and erythema of eyelids with purulent discharge. The mother was not screened for sexually transmitted infections during pregnancy. Which complication should be considered if the infection extends beyond the conjunctiva? Orbital cellulitis, retinal detachment, blindness, chronic necrocystitis, or optic nerve hypoplasia.
B.
Um, blindness is the most important complication which can occur. So option C. CDC recommends yearly screening of sexually active women and pregnant ladies for gonorrhea and chlamydia. The highest incidence of gonorrhea happens in which age group? Um, 6 to 14, 9 to 15, option C, 15 to 24, or option D, 30 to 45, or a later age group, 50 to 65.
D.
Um, so these are some of the overlapping age, but for my MCQ key, 15 to 24 years, the age of adolescence and early age group are the most common. So this is a YouTube link where the this video will be uploaded, and thank you very much for listening.
Thank you so much, Dr. Taimia. It was
Thank
a
you.
very good presentation and
Thank you.
very informative.